Focuses on diet and nutrition in cancer, always a very popular and very important topic, and Marian will give us an update today. Marian?
Thank you, and good morning, everyone. It's great to see such a great attendance. And I just want to mention at the outset that those of us who are speaking this morning, we love science and medicine. We just love it. But the main reason we do this is for all of you. We want to make sure that the work we do helps patients and their families. So there's several questions we can ask about diet and prostate cancer, and if you've been here last year or the year before, I focused quite a bit on these first two questions. Does it matter what you eat, and does it matter how much you eat? And these are two questions that we are working on very hard in our prostate active lifestyle study led by Dr. Wright, who will also speak this morning. And I spoke a little bit about that last year, and we really feel that those two questions are very important for that study and for those patients. What I want to focus on today is a question that maybe you haven't thought so much about, and that is, does it matter when you eat? And does this matter for your cancer and for your overall health? So there's two aspects of when you eat. One is eating frequency, and the other is time of day. And I'll cover both of those in the next few minutes. So eating frequency refers to the number of eating occasions per day. So meals, snacks, and beverages. It all counts. How many times are you eating per day? Here's a very simplified diagram of how some people may eat. So some people eat regular meals, say 3 times a day. Others may eat small meals, a snack, and so on. So 3 meals a day and snacks is what we might call a common diet. 3 meals a day consumed during the day is this kind of pattern. You might have heard of the 5-2 diet, where people eat 2 meals a day but no breakfast, and so on. So there's a lot of different eating patterns that people have, and this is really a current area of intense research among nutrition scientists across the country, including myself. So very briefly, every time you eat, it causes your blood glucose and your insulin to increase. And how that might relate to cancer is shown in this very simplified diagram. And what I want to emphasize is this is very simplified, but it's mainly to illustrate, because biochemistry is complex, but mainly it's to illustrate that some of these factors that we get from food, nutrients, and especially insulin, which gets pumped out every time you eat, it has a number of effects that we call downstream. So insulin goes through a number of different steps, and then eventually lands on some of these molecules called AKT and mTOR, which are then very directly related to cell replication and cell survival. So again, this is just a very simplified way of saying that every time you eat, this system gets revved up. So it's possible that when one eats more frequently, there's more insulin, and the system says go. For people who eat 3 times a day, each time you eat, again, your blood insulin and glucose go up, and then they come back down. The next time you eat, it goes up, and then it comes back down, and so forth. Hormones, to me, are a very interesting aspect of the human body because they seem to be like a big orchestra. Certain hormones get released at certain times of the day in response to certain stimuli. Other hormones get released in response to other stimuli, and it all works together in a big orchestra to make our bodies run. Even when we're down in this area, when our blood glucose and insulin are a little bit low, like before we eat, we have other hormones that are working. They're called counter-regulatory hormones that are doing their job. Well, if someone is eating all the time, say in a grazing meal pattern, those counter-regulatory hormones never really get a chance to get turned on. So the orchestra is not really working. The woodwinds might be playing all the time, but the strings don't get a chance to play. So a frequent or grazing eating pattern may be detrimental because there could be constant signals sent to increase cell proliferation and cell signaling, and of course that's related to cancer, including prostate cancer. However, evidence is needed to confirm or refute this, and so in my research group, we're currently doing this in a randomized controlled trial, and I'll talk about that in the next few slides. And typically, when we're exploring these sort of etiologic hypotheses related to eating and nutrients, we often test it in healthy people first who are free of cancer before we go to cancer patients. And so that's what we're doing right now. And here's a simplified design or a schema of what we're doing. So this study takes place over in the other building where you were last year. We have a wonderful prevention center where the PAL study is also taking place. We have a metabolic kitchen, an exercise facility, and a great place to do cancer research studies. So we're recruiting adults between the ages of 18 and 50. They cannot have any eating disorders or medications that affect appetite. And then we do have some stratification factors. We're recruiting people across the range of body weights or body mass index. So they are randomized, first to eat 3 meals a day or 6 meals a day. And then they undergo a washout, and there's a slight typo here. This is supposed to indicate that it is a crossover design, so each participant does both arms of the study. So if they're randomized to eat 3 meals a day on the first arm, they eat 6 meals on the second arm, and so forth. And these are what we call isocaloric diets. So basically, they're eating the same foods and same calories on both arms of the study. They're just split up between either eating all those calories and foods 3 times a day or 6 times a day. And this allows us to test whether the eating frequency has any effect on a number of blood measures of inflammation, satiety, and insulin resistance, measures that can affect cancer risk. So essentially, this is a study trying to test whether eating frequency can affect the biology that may be related to some of these downstream effects. So let me tell you a little bit about some of our pilot work that led to this. And when we do pilot studies here at Fred Hutch and also UW, these can be extremely helpful in helping us get larger grants. And that was the case with this study. And often the pilot data just gives you a little bit of a hint, but our pilot data were really pretty good and helped us get the larger grant. So let me show you this slide. Here, it was the same study design. Participants were in a randomized crossover study where they ate 3 meals a day, or in the pilot, it was actually 7 times a day. And we were comparing this biomarker called high-sensitivity C-reactive protein, which is a generalized marker of inflammation. Inflammatory factors are often seen in many cancers. So what we found was that in the grazing condition, or the frequent eating pattern, that CRP was higher. And it was not quite statistically significant, but for a pilot study, it was enough that we could draw the inference that a grazing eating pattern would increase your C-reactive protein. We also measured something called insulin-like growth factor, and a lot of prostate cancer studies have examined this biomarker, insulin-like growth factor, and it's in that pathway that I showed a few slides back. We found the opposite here. We actually found that in the grazing pattern, the IGF-1 was lower. So clearly we have a lot of work to do to try to understand exactly what is happening with these eating patterns and how it affects the biology. Well, what happened with self-reported appetite? We found that high eating frequency actually had a greater level of satiety based on self-report. So in other words, the participants reported that they had greater satiety and they weren't as hungry between meals when they ate the 3 meals a day, versus the 7 meals a day. So again, the question is, does it matter what you eat? And my own data plus the other research literature that's out there still suggests that there's a mix of data. Some data suggests that more frequent eating leads to better metabolic profiles, better satiety scores, better health, whereas other data shows that the opposite, that less frequent eating may lead to better metabolic profiles, better satiety scores, and better health. So right now, the data are very mixed, and that's why I'm very interested in this research area, because I want to help answer this question and then try to determine how that can help people who are at high risk of cancer or cancer patients. So now let's talk a little bit about the second aspect of meal eating. And this relates to timing, or something called the circadian clock. And you can see from this very nice diagram here that we have this thing called the circadian clock, and we have a lot of our function and biological processes that are really programmed to happen at certain times of the day. And some of those you can see right here. Well, how is that related to eating? Well, there are certain things that happen when we're awake and feeding that happen in our bodies in terms of producing cholesterol, bile acid synthesis, fatty acid synthesis, and so forth, and then certain things that happen when we're fasting. Well, if we alter the eating frequency, or if we alter when we eat, does that modify the biology? In other words, if you eat when you're supposed to be in the sleeping or fasting state, how does that affect all of these things that could be related to cancer, such as oxidative metabolism, mitochondrial biogenesis, and so forth? Does that affect that? We don't really know the answer to that question. There have been a few studies done in breast cancer patients where they asked the breast cancer patients to stop eating after, say, 8 o'clock at night and have at least a 12-hour fast. And those results were actually quite stunning and interesting, that the women who had a longer overnight fast had better outcomes. So this is something I'm also planning to explore in a future study with prostate cancer patients. So not only how many times someone eats a day, but the meal timing and when you stop eating at each time each day. So I'll just leave you with this final slide, just to remember that nutrition is quite related to a number of biological processes related to cancer incidence, progression, and mortality. And I'll just highlight a few of those here: DNA repair, proliferation, differentiation, apoptosis, cell cycle. Everything that you eat gets broken down by your bodies and then gets out to run the cells. So thank you again for attending today, and I look forward to your questions.